Live, sir.
Good evening, everybody. I hope you are all enjoying the continuous integrative medical education series. And hope you recall yesterday, Dr. Rudra Bhandari came and gave a very nice description of the yoga personality, the various panchkoshas, and how to manage oneself. And that was a very good description. And it went on almost for an hour, which was unprecedented, although a little long, and I apologize for that. We're going to switch our gears a little bit today, and this evening we will move to a more of a therapeutic aspect of systems of therapy outside the modern medicine fold. And today we are joined by a very eminent person, Professor Jp Agarwal. Dr. Jp Agarwal has joined us from Prayagraj all the way, along with his very big team. He represents and he runs the Acupressure Shodh Prashikshan evam Upchar Sansthan at Prayagraj, and that is next to the river Ganga or the Ganges for our international viewers. And he has been running a huge college, and we are told that this acupressure that is going to be talking to us about acupressure, Ayurvedic acupressure, is a vast field incorporating different divisions. And to those who are new to the acupressure field, we would like to have your feedback after his talk, and he will use a PowerPoint slide presentation. And then if you all want to go further on to explore the various fields and subdivisions of the field, then we can request him to have more sessions and series of programs. So I'll just briefly introduce to you formally who is Dr. Jp Agarwal. As I mentioned, he is the president of Acupressure Shodh Prashikshan evam Upchar Sansthan at Prayagraj, UP. He's a retired member of Tribunal Sale Tax and working in the field of acupressure for last 25 years. And he has authored several research books, more than 50, based on the Ayurvedic concept and vision in both languages of Hindi and English. So he claims that he presents acupressure in a Ayurvedic framework, which is very unique and rarely found. And he has a treatment hospital next to the river, and where patients from all across, including those suffering from cancer to pain management and other that he will relate to us, are all coming and taking the treatment. But now, because of the lockdown, he just mentioned that they are still continuing with the online aspect of counseling and therapy. And so we will not take too much of time of between you and him. And other than requesting Dr. Agarwal to please introduce to us the field of acupressure, what is the conceptual framework, where does it come from, and what are you doing in the field, and how do you think it is useful for therapy? From my personal little limited knowledge I thought this was more of a field which pertained to our anesthesiologists, people who treat pain, the people in the pain clinic. But in our informal discussions, you mentioned that it is also useful for arthritis, and it's also useful for cancer and heart diseases. So that's very interesting. But here in this particular platform, Dr. Agarwal, we are doing this program through the lockdown. You can call it a lockdown series. The idea is to bring in the best of the East and the best of the West based on sound scientific evidence. Whatever that falls through or it matches the rigorous methodological pursuits followed by scientists or practitioners, is welcome to be adopted by, and that is what we advocate. If there is evidence, we should try to put it across to the policymakers, so that could be included as a part of a integrated healthcare framework. So with that thought, we've been bringing people all the way from technology to engineering to physicians, Ayurveda charyas, yoga charyas, biologists, and even spiritual masters, all the way from His Holiness Dalai Lama to Sadhguru Swami Ramdev. We've been inviting them and trying to learn from their own perspective of health and wellness and treatment. And it has really been a very nice, I would say, academic sojourn or academic journey every evening, trying to interact and learn. So this is a very unique forum in which you get to interact and interface with healthcare workers, yoga academics, physicians, a lot of students, people from the Ayush system, a lot of policymakers also, and a lot of them also from Latin America, US, Europe, European Union. So although you cannot see them, but they are all there and they will just join. And today we crossed the 11,122 subscriber database, which is a very not bad for just about 138 days. This shows that the program is developing some sort of an acceptability and credibility, and we want to maintain that. So I request you to please give us the insight into your field and your enterprise, whatever that you've been working on. And thank you for coming with all your team. So we look forward to your presentation. Welcome, Dr. Agarwal.
Thank you, Dr. Anand. Lot of thanks, Dr. Anand, convener of this workshop, and his team. Before I take up this, as you suggested me to tell about the Sansthan and activities. So, in the limited framework of the time, I would like to tell that we have the around 700 centers working all over the country for the treatment. And the 70 teaching centers are there in the country, and they are teaching, they are meant for the distant learning on the pattern of the IGNO, which we started way back to a few years. Now, this has been withdrawn, but all our activities are in the knowledge of Honorable Ministers Shripad Nayak ji and Mr. Ashwini Chaubey ji. Those, they are regularly visiting in our conferences. And we have a very big team in the research and in the treatment, and the research treatment. And third segment is the training. And it was founded by great scholar and philanthropist who is the perpetual source of inspiration, Mr. M.P. Khemka, along with his colleagues. And now, just I start with the one thing more I would like to tell, that not only the naturopath and the acupressure therapist are associated with us, but very eminent medical doctors, just Dr. Prakash Ketan, neurosurgeon of Prayagraj, is a man of international fame, and also cardiologist Dr. V.M. Kohli from Metro Hospital and Max Hospital, and previously he was working in the escorts, and so many other doctors. And the head of the department, the late Dr. G.C. Agarwal of Allahabad Medical College, he has written so many books for therapists on the subject. Overall, about 150 books are on the various branches of the this related with the acupressure. We teach 3 types of the courses: just TCM, traditional Chinese medicine, that is the based on the Chinese acupuncture. Number 2, that is the physiology anatomy, and third one is the Ayurvedic acupressure. This is the 3. The unification of the 3 courses make one certificate, diploma, advanced diploma, and further. So, till this moment, more than 1 crore the patients have been treated at the various centers, and roughly speaking, more than few lakhs the therapists have taken training. Now, just I would like to tell that the almost the most chronic cases, just the patients of the cerebral palsy, CP child, brain disorders, cerebral atrophy, spinal degenerative disorders, slip disc, and all that. And arthritis, I focus upon this word arthritis because most of the patients of the arthritis, they do come after having the treatment from other therapies. Now, on the basis of the research, what we have established that it is of the three types. Neurogenic, that is the based on the this spinal peripheral nerves ramification through the from the lumbosacral region, and also the frozen shoulder and cervical spondylitis on account of this uh, lum, cervical nerves. And second is the metabolic arthritis, that is uh, based on the rheumatoid factor positive, CRP positive, and also this gout on account of the disorder of the uric acid. And lastly, the circulation-based arthritis, that is the the arteries of the four limbs when these are the sluggish flow of the blood, and that causes the uh, polio and the painful. So and all they have been registered, and the case histories have been made out. Now I come to the and also hormonal disorders, uterine fibroids, digestive system related disorders, kidney failure cases, all type of the stones, and heart disease, lung related disorders, and hematological disorders, all type of the anemia, deficiency of the hemoglobin, platelet, and all that. This is the brief overview of the activities of the ASPEUS therapist over the past 25 years. Now, I come to the topic Ayurvedic Acupressure. My dear friends, acupressure, uh, acupressure is composed of two words, acu and pressure. Acu means very subtle point on the body when it is pressed, and this the balance of the energy is made out, is restored to the connected organ. And Ayurvedic acupressure is composed of again two words, acupressure and Ayurveda. As we know, Ayurveda is again composed of two words, Ayu plus Veda. Ved means knowledge, Ayus means life process. So, need not to say what type of the diseases can be treated with the fusion of this TCM, physiology, anatomy in the mold of and under the vision of uh, Ayurveda. So, and the main objective of Ayurveda itself is Prayojanam Chasya Swasthasya Swastharakshanam Aturasya Vikarpashanam Cha. Meaning thereby to maintain health of a healthy person, to cure the health issue of a diseased person, to live gracefully and harmoniously in the balance of the body, mind, and soul. Ayurveda acupressure system focus on the curing of illness as well as the prophylactic prevention and promotion and the upkeep of the health in healthy individuals. In substance, what is when related with the medical system or the uh, that is the when it is therapy, for the controlling disease process. What does it mean? It simply means that what is the medicine in it? Sir, no medicine at all. Only the energy treatment. By virtue of the pressure on some points on the body, and it is the treatment of energy, by energy, for energy. Just subsequently, I'll speak about how it works. So, tripodic, when we talk about Ayurveda, it is and in substance, it is tripodic. That just every living being get the energy, the prenatal energy that is from the parents. That is the first source of energy. Number two, after the birth, from the diet and food, which is the main, that is the diet style. That is the sole basis of the Ayurveda. And number three is the cosmic energy. That is the cumulative atmospheric conditions, whether that is season, climate, or the pressure, temperature, and the moisture. This is again tripodic. That is how the human being is affected by that, this cosmic energy, because through the brain and the spinal cord, all the sensitivity, whether when there is a higher of the temperature or the low of the temperature below the normal, then the hot and cold conditions are felt through the spinal nerves and the brain. So this is the biggest source of the energy, and we can treat this, control the weather conditions, aggravation in arthritis or in so many diseases. So this is the tripodic source of energy. And in Ayurveda, the mention of the marm therapy, this is nothing but the similar to acupoint. Just on the page number 9 of the PPT, marm therapy is an ancient Indian practice whose focus is manipulation of the subtle energy, that is the prana in body, for the purpose of the supporting the healing process. During the ancient time, during the wars, when some arrow is struck on the body, on the vital point, that was very fatal. So what instead of the surgery, after removing that arrow, the healing on that point was providing the surgical effect. This is all this mention of the 107 vital points in Sushruta Sanghita. The two biggest and the most eminent, the treatises, Charak Sanghita and Sushruta Sanghita. So all the physiotherapies or the physical disorders are totally based on our research from this Charak Sanghita. Now, what is acupressure and acupoint? Dear friends, on human body, the specific points have been identified by the scientists and the scholars. When pressed by any blunt object or the fingertips, this pressure causes the balance of energy in body organ related to the point. This is known as acupressure. Such point is known as acupoint. Now, the tripodic acupressure treatment is again that is based on the Tulyartha correspondence system. Number two, meridians. Actually, this acupressure the thought process of the Ayurveda and the treatment of acupressure, whether it is based on the reflexology or Sujok or the TCM, but the all are in the mold of Ayurvedic vision. So it has become very potent. So, so different modes of now we describe the different the different modes of the treatment. That is when the needle is pressed on the acupoint, it is known as acupuncture. And when very small micromagnets are used on these acupoints, this is known as magnetic therapy. And when the color is applied on these acupoints, it is known as color therapy. And when, just like this, we use the seed, methi, matar, gram on different parts of the body, or especially on the joints of the palm and uh, finger joints. That gives the very good effect of the treatment and sometimes instant. So the different modalities, acupuncture, magnet therapy, color therapy, seed therapy, all are very simple to treat. And this affirmation and the expansion of this treatment system based on the meridian, Dr. Wall of the Germany affirmed it and correlated all the points with the physiology and anatomy, the different parts of the brain, different segments of the kidney, and different parts of the heart. And this treatment could be useful for all the systems relating to human body. Now, the sole basis of the treatment on the palm, that is this I give you, and it is very clear from this slok in Sutra Sthana of the Charak Samhita. Yavanto hi murti loke murti mantah bhavishesa tavantah purushe yavantah purushe tavantah loke, meaning thereby, as many physical or metaphysical components are there in the cosmos, so also repeating and there in the human beings, and as many as components are there in the human beings, so are the in the cosmos. That meaning thereby, we are the components of the cosmos. The oceans, rivers, mountains, and forest, and sun, all are the natural objects, and the same thing are there in human body. On page number 26 of the PPT, there are the three pictures. One is the first dimension is that of the nature, almighty nature, that is cosmos. You see, there is a space, ethereal space, and that is the covering as a gaseous envelope over the surface of the earth. That is the first element, Akash. Number two, there is a wind, that is the circulation, movement, and that is the second element, that is the part of the cosmos. And third, you see the sun, biggest source of fire and thermal energy. This is third element is the fire. And fourth is the rivers, ocean, and the 3/4 of the globe is that of the water bodies. So this is the fourth element. And fifth is the earth, that is the mountains, plains, plateaus. These are the five elements have been made the basis in all the acupressure and acupuncture system, especially in the Chinese. But This is of only 3,000 back. But in Ayurveda, right from the beginning, all the things are there. And these five elements are being repeated in the human body. This is the second dimension. And we see that the covering of the uh, human body, that is the skin, just like the Akash. And connectivity to the lung system, breathing, that is the Akash. Number two, movement, that is the wind, presence of the wind in the human body can be seen from the impulse from the nervous system and the circulation of the blood. Number three, this fire. Everything is known in duo, that is whether it is acidic or alkaline. Unless and this is, it means that the combination of that is the presence of the fire. And fourth is the body fluids. Again, we know that it is parallel to the cosmic composition and of the cosmos. 3/4 of the human body, that is uh, body fluids. And fifth is our bony structure, just like the earth. So these are the five elements which have been made the basis in all acupressure and acupuncture. But dear friends, Ayurveda speaks something else more than that. Apart from these five elements, there I'll speak about. Now, this is the basis of the Tulyartha. Repetition of this principle is dynamic. The cosmos, we human body are the components. It means that the whatever is there in the cosmos that repeats and that is manifested in the human body. This is not stopped here. Again, this principle is further. It is the principle between the macro and micro. The cosmos is the macro, and human body or the animals, insects, or the plant life, everything are the components. And second dimension is the human body, that is that is representing the cosmos, and human body is again represented by the palms and the feet. The meaning thereby, the whole human body is corresponding to the structure of the palm. It means that if the whole body is to be treated, only one palm can be treated, and just simple pressure can be given, and that will be the prophylactic treatment. Can anybody believe that this is so simple? Yes, sir, this is very simple. Now, when you see this slide, you'll find that it is just like the human body. Thumb is just like the head, and it has the two joints only. We can see in the head, the neck and head only having the two joints. And the four fingers are like the four extremities. Index finger is the right arm, a small finger, right a small finger. This small finger is left arm, and middle finger is the middle and ring finger are two legs. All are having three joints. And this is the chest, abdomen, and pelvis. It is something just that is the software of the human body. Now, if we have to treat the head, we have to put the pressure on the upper joint and the correspondence of the head. This correspondence means the Tulyartha. Everything is corresponding. Whatever we have in the chest, whatever we have in the throat, neck, whatever we have the head, as we know, head contains the brain. Brain is having two lobes, right hemisphere and left hemisphere, two hemispheres. And each hemisphere has four lobes: frontal, parietal, temporal, and occipital. And below this head, we have this neck and having the cervical vertebrae. And inside the oral cavity, there are so many glands, eyes and nose and everything. These are embedded in the anterior part of the thumb. Now, below the wrist, we come down to the chest region, and this is similar to the, the arrangement of the heart and the two lungs uh, side by side. And the below the diaphragm, there is a series in horizontal line. There is liver, gallbladder, stomach, spleen, pancreas, and two kidneys left and right. And below that, uh, the small intestine and the large intestine and gonads and all that. So all these organs inside the body, the correspondence is there, my dear friends. We want to treat on the liver or the heart. It is meant for the diagnosis, also for the upkeep, and also for the when the disease process comes in. So this is the place where we have to press. For example, we have the chest pain and we are panicked. The entire, all the atmosphere is panic, and hospital and doctor is not available, or the time is not there to reach the hospital and doctor. And what, whether you have to see, first of all, whether the chest problem is due to the cardiac problem, cardiac disorders, or due to some other reason. Maybe gastric problem may be there. When you press here, you will get instant relief. This is the testimony, what we have seen. This is one way of the treatment, and this is the general treatment of the uh, heart. When a specific treatment will be given, just in Ayurvedic acupressure, everything has been uh, specifically can be treated. The four chambers, or the aortic wall, or the mitral wall, tricuspid, or the 10 coronary arteries, or the AV node, or the just SA node, all these can be separately. We have the point on the, even on this palm and fingers. This is unbelievable, but it can be. When we have any problem, digestive problem, or the liver treatment is the for the maintenance of the upkeep of all the organs in the human body. Because if the function of the liver is around 1000, and uh, it deals with the 500 chemicals and responsible for the cholesterol, or the kidney failure because of the protein metabolism. Fat metabolism causes this uh, cholesterol and fatty acid, and this carbohydrate metabolism that causes this diabetes. So the treatment on this liver correspondence may be helpful for the heart disease, may be helpful for the chronic disease, all the metabolic disorders, vitamins and minerals deficiency in the bones and all that, or in the sense organ, everything, because the all metabolic activities are performed. This is the general treatment of all these. Even the chronic arthritis and the pain, because the basis and the causative factor, that is from the liver. And while we treat it, we get the response. And then this is the general treatment. By use of any gadget, we can treat like this. Just this is the correspondence of the liver. Just we do that, and you will get the response and reply. Then this is the anterior part and the back of the, on the next PPT. the back of the palm that represents the spinal cord, the spinal column, or 33 vertebrae, and peripheral nerves, and the head. This is the not only the head, cervical, and all these treatment can be done. Now, very simple. This is the thumb, the back of it, the below the upper joint. If we press here, most of the people suffer from the cervical spondylitis. Not to talk of the ease, not the degenerative, not the aging process, even the age of 20s, 30s, 40s, because hectic working on the laptops and all with the posture and less of the physical activity, more on the gadgets, digital gadgets. So the cervical problem and dizziness and all that. This can be treated like this. Just giving pressure on the thumb, back of the thumb, and below the wrist on the back part of the, that is the posterior part of the this palm. This is nothing but the area of the dorsal spine and then goes deep down to the lumbosacral. Low backache, everybody suffers. Most of the people, they are suffering from the low backache or the mid back or the cervical spondylitis. I'm not talking about the presently the degenerative conditions or the slip disc, but even then, instant relief you will get. In the workshop, many thousand people are there. They can try it and they can give the feedback. Just if you people are seeing this PPT, Priyanka ji, the PPT is not on the screen. Mr. Verma, can you show on the screen all these PPT, especially PPT number page 27?
Okay, sir. I am showing 27.
27.
Okay. Sir, you just speak the number. I will show that page.
Okay. Again, Nev, you start from the page number 26, the 3 dimensions to Tulyartha. Please. I will not take much time, but the very pragmatic and important treatment will be conveyed to all of you so that you may feel it, try it, and get the response.
Actually, 26 number page.
26.
It is 26 now.
And then 27.
Okay, sir. It is 26.
That's what I told about the correspondence system of all the organs on the palm. This can be displayed from this page number 26, and the composition of the cosmos with all the elements, and then second that is the human body. It will take time.
Sir, it is displayed, sir.
Okay, but I am not seeing on this screen. I am not able to see, just like we used to see in other workshops, so that
Sir, we are able to see.
Okay.
Okay. Yes. Sir, this PPT 26 is showing on Facebook also.
Achha, but not in this Zoom ID. Zoom.
Okay.
I'm not able to see.
Okay. So just swipe left and see.
Okay.
Or swipe right. Go to sir first side, your side, back.
No, that is not visible.
Yeah, better not play with that. We may lose you. You can carry on.
Okay. The posterior part of the palm, the entire very good treatment of the low back or the low back and the cervical treatment, which is very common, and it is causative factor that the pain radiates to the hip joints and the knee joints and all that. When specifically we treat this, we treat when we treat we treat the spinal correspondence, lumbosacral, we get relief in all the joints. And this is the causative factor and the basis for the neurogenic arthritis. And in specifically, we'll show you how this can be treated, the arthritis or the frozen shoulder and all that. Now, see the page number 31, 32, and 33 and 34. These pages are devoted to the frozen shoulder treatment, the knee pain, ankle joint pain, or the overall the arthritis of the different joints, and also the wrist pain or the elbow, tennis elbow, or the degenerative changes in the. So both a IF, index finger, and the small finger, both being the uh, correspondence of the arms, the cuff joint. We just give the nomenclature, the distal joint as a Vata joint, middle joint that is the Pitta joint, and the proximal joint that is the cuff joint. Meaning thereby, if the frozen shoulder is there, if the, for example, right frozen shoulder is there, we should apply the methi strip on the right index finger cuff joint, that is on the proximal joint. If there is a knee pain on the right knee pain, then we should apply the methi strip on the right index finger pitta joint. And similarly, the ankle joint can be treated on the right IF Vata joint. Sorry, this is the elbow joint, right IF. When we take up the hip joint and all that, the right middle finger calf joint is being treated or meant for the treatment of the hip joint. And for the knee, this is the right middle finger pitta joint. And Vata joint, that is the distal joint, that is on the Vata joint methi strip. Similarly, or left, right, all the joints can be treated. This is the first step of the treatment of the arthritis, and you can get the instant relief. But I don't mean that it will be just give the cure effect in 1 day or two. Now the other modality we can do in the other system. This is the Tulyartha comparison, that is the corresponding system. Due to correspondence, this treatment was possible. And now the color treatment can be given. You see on the, I'm showing on the my left palm. Here the some color applications are there. This is meant for the acidity and combination of 4 colors: green color, light blue color, and this violet. All these 4 colors are meant for the acidity. Even one color, that is the, just you put your ring finger where it touches, you take the sketch pen and apply the green color. You'll find the difference. Within 2 or 3 hours, the gas will be passed out and the abdominal distension will be clear. So these are the few tidbits for the treatment. And this is, any treatment can be given for this, all the organs, but this is the general treatment.
Thank you, Dr. Agarwal,
Treatment,
for
we
this
can go for next
Thank
series of
thank you for the nice presentation, Dr. Agarwal. I was looking at the PubMed. You know, PubMed is one of the scientists' favorite Google engine, which provides the entire bunch of publications or the data from various interventions, whether diagnostics or therapeutics. So I found when you put in acupressure in PubMed, I found 1,386 publications. Most of them were towards pain management and labor, and some towards arthritis also. But I was still wondering how the mechanism, what must be the mechanism underlying the pressure points. So when you press somewhere, and even though you have corresponding points of the various organs on your hand, my first question will be, how are we sure that these points, these pressure points in the palm actually represent the organs? Is it only experience based, or is there any theoretical or any confirmatory evidence of that? And number two, if that is so, then how pressing here and there to those corresponding points, assumed to be correct, will bring the change? What are the, if not the molecular mechanism, at least the physiological mechanisms? Can you reflect on this briefly?
Yes, 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 sir. Very good questions you have put in. Sir, just I told that there is a tripodic creation of Almighty God. The cosmos having the components, and the human body is one of them. And all the elements are there, because all these systems of acupressure and acupuncture are based on the element system. They believe it. When this came into existence, and there was nothing like that physiology anatomy, and everywhere there was empirical. In Ayurveda or afterwards, 3000 back before this Chinese acupuncture, which we used as acupressure, the same principles based on the this 5 element. And one dimension was the cosmos, another was the human body, and that was repeated. And the similar structure we can find and we can see. The testimony, the empirical treatment and the result. Number two, you can look at the palm. The thumb is the head. Nobody can believe it. I also did not believe before 25 years back. But when we started, and I saw, and I told you that the head has the 2 joints. Sir, you are the noted, very eminent neurologist. And you see the structure, the different, the thumb has the different joints structure than other fingers. All other fingers have the 3 joints. These are the 4 extremities, extensions, and head. Then this palm is, it is divided into 2 parts, roughly speaking. The above the diaphragm, that is the chest region, the 2 lungs and the heart in between. And below the diaphragm, 2 kidneys at the outward side, and below that, the arrangement of, or in that in horizontal position, liver, gallbladder, that is gallbladder is embedded, then stomach, spleen, pancreas, and
So I understand what you're saying, the importance of
Yeah,
empirical research and how
yeah,
it evolved. That is well taken.
yeah,
But let me very simply and more easily, uh, you know, invite you
yeah.
to join a research program where we can enroll, let us say, 100 patients of migraine with the help
Correct.
of our neurology colleagues. Because
Yeah,
I'm a
yeah,
researcher and I
yeah,
look at molecular pathways and the cellular cell culture animal models and
yeah.
all. But with the participation of our clinical colleagues who are neurologists or other physicians, would you be interested in joining hands in looking at the outcome of anti-migraine drug for, let us say, the 100 or 1,000 people suffering from migraine
Hmm.
versus those who will be given acupressure or acupuncture from you? Would you like to join it? Whatever be the results, we can mask them, we can control them, we can, randomize control trial in that study design framework. Would you like to join such a team to investigate and examine and generate evidence, whichever way it goes?
We'll talk later on. Actually, uh, there is a when there was no lockdown, 500 patients we were treating in the OPD. So this was very tight schedule, and there was no off day. And also we have the full-fledged college, and the admissions of the students and also indoor patients are there from all walks of life and from all the corners of the country, even from the abroad.
Sure,
The people come and live there and have the treatment
sure.
and try to learn how to actually they do it. You see, just you talked about the migraine. We have to find out the causative factor. The Ayurveda, the vision of Ayurveda is tripodic, means Hetu, Ling, Aushadha Jnanam. Hetu means causative factors we have to find out. Whether this headache is on account of this acidity, the that is rising and going up and up in the head, and there is the inflammatory conditions, or it may be the neural pain, and the headache or the such pain is can be managed immediately, but it will not be cured unless until we find out the cause. It may be the due to the less of the circulation by the heart or something else, or this may be the neural because of the cervical nerves, or sometimes um, what we have seen, there is some lesion in the brain and cyst and cysticercosis causing the, but the exact word, the migraine, the patients those are having vasograins and migrainils and all that migraine medicines continuously. But we found that we when we tried to control the acidity, that was the one part, causative factor. Other, the what I emphasize upon, the liver is very important organ, as you know, as a neurologist, because the uh, all metabolic activities are performed on the food.
Yeah,
So
no, I
this
just
is the
wanted to know. No, I understand you very nicely. You gave us a classification of migraine types, and you emphasized that the importance of origin of the pain or the problem is very important. You mentioned the word.
unless until we
Correct,
do actually holistic treatment should be there.
correct,
The,
correct.
in part, it is not possible.
Yes. So
Even
you are open.
in the kidney failure cases, sir,
Right.
we
So
have to treat the hemoglobin. We have to treat the this liver function should be corrected, or this creatinine and urea and this EGFR has to be taken into consideration, and the the blood pressure is also to be taken into account. So
after having a very strict inclusion and exclusion criteria, you are
yeah, yeah,
open. I just wanted to know whether you're open to research. So it's good that you're open. And I will now, since we have had a very good discussion and a comprehensive and very relaxed presentation and very confident presentation from you, attended by so many people on the Facebook and also on the panel. I will just pose one last question, and then we can request you to have, a subset or the specialized aspects of acupressure on consequent days, other days, if you agree. The last question is, I think I represent people in the other audience. What is the fundamental difference between neurotherapy and acupressure? Because the neurotherapy people also identify certain spots in the body and they press it in a certain fashion, and they claim that some of dopamine and other hormonal secretions are induced or prompted, and so that way they are able to exert the necessary expected benefits. So very briefly, what is the difference, or is there no difference?
Yeah. Sir, I would like to tell you again, I will emphasize on the holistic nature of the human body, and the treatment should be that. You see, the cranial nerves and also peripheral nerves, and the nervous system is having so many plexus. The celiac plexus or the cerebral plexus or the all these plexus. We have in also a branch yogic acupressure. What does it incorporate? We have found out the correspondence of the plexuses, which are corresponding to the endocrine glands in the nervous system, and you see, the entire nervous system is the controller of all the system, whether it is the circulation system or the breathing or respiratory, or any other system. And the entire nervous system is controlled by the hormonal system. So on these are the points of the this is yogic. These are the points of the plexus, the chakras, and these are the correlated with the endocrine glands and also the plexuses. On the back of the palm, the correspondences of the plexus we have found out, and when we apply the micromagnets, that is meant for the bipolar magnets, tonification or sedation. So this is way to balance out the energy system. For example, some uterine disorders are there, hormonal, or some prostate problem, mostly in the female disorders. There should be the control from the hypothalamus and the pituitary, which are embedded in the head. So these chakras are corresponding to pituitary, pineal, and the hypothalamus. Then thyroid and hypothyroid. Then all Anahat chakra, that is parallel to thymus. Manipur chakra, this is the place here, and like this. So this is the correlation. We cannot talk and treat in fragments separately. The body should be taken as a whole. For example, for all the cardiac problems, first of all, we have to see the lungs. Whether the lungs, because without the purification of the blood by the lungs, heart cannot do anything. And heart, without having the quality and quantity or the biochemistry of the blood, is not controlled by the heart. It is by the digestive system. So we have to take the digestive system also. Whether there is some anemic heart is there, or there is anemia, how the healthy heart can be. And moreover, the connectivity from the spine from D4, D5 to the heart. When being a machine, unless until it takes the power supply from the spinal cord, it cannot work smoothly. And also, as a fuel, the blood is the fuel of the heart. And if it is not very well produced and all the organs are not working in integration, even the oral cavity, even teeth and grinding and all that, the healthy blood cannot be formed. If the duodenum is not working,
the
liver,
interconnectivity. Yeah, please go ahead.
any of the organ, kidney, liver, and all that, the heart cannot be treated well.
So the
So always
interconnectivity.
we have to think and do in perspective of the holistic approach.
Absolutely.
It cannot be that in parts this is being referred. It is very why we have joined you after 20. We have appeared and come on the scene on the platform after 22 years. Why? Because we had to work a lot. We had to study physiology, anatomy. We had to study all the systems relating to the acupuncture and all the principles are one and same. Nomenclature is different. 3,000 years before, there was no physiology, anatomy. There was metaphysical and physical concept only. The element basis and the energy basis connecting to that. They consider every philosophy has darshan. What do you mean by darshan? Philosophy propounds the vision and scientific basis for the enactment by experiment and all that. So everything started empirical, giving the results. And out of 10 similar patients, when we got, we saw that more than 6 are responding by the same protocol. We have more than 10,000 protocols regarding all. Even the headache, at least 10 protocols. Kidney failure, even the kidney stone, it is very simple but very ticklish. So what part in the pelvis or the calyx, minor, major, where it is? If
so
it is...
no, I completely agree that the interconnectivity is paramount, and regardless of empirical nature or the current molecular nature or the description in a more advanced fashion, if the benefits are coming on behalf of the integrative medicine case reports, which is published at PGI Chandigarh, we invite you to publish those protocols with us, case to case, whatever benefits your people.
Sure.
So because we accommodate publications which are structured with an abstract, introduction, methods, results, discussion in a nice manner, we can help you to do that, write that up also. And under standard peer review, other people will come to know about it once it gets published, and the evidenced way, in an evidenced fashion, in an evidenced manner, I mean, backed by evidence, we can take it further on to be integrated in a holistic healthcare system model. So I would like to thank you on behalf of Yoga.
One thing, because you are great, eminent neurophysician.
I'm a scientist, yeah.
A scientist. I would like to tell you the 4 ventricles in the brain. When there is a prominence of the 4 ventricles, it can cause many more illness, many more. And if there is some problem, this Salkai and Jairi are the prominence. In the MRI, there is the mention in the body of the report, prominence and dilatation of the ventricles. But in the impression, cerebral atrophy. But in the case of the 20s or the 15 teenagers, it cannot be cerebral atrophy or age related. The ventriculars dilatation, or this is meaningful, and this should be treated. And so many cases have been treated. The symptoms, they came with the symptoms, the loss of vision in this age, no ophthalmic remedies are there. Then we could find out from the MRI, there is some problem, some lesion, infarction. If there is infarction, lesion, all have been treated and the case manual have been developed. But we could not send all these to the Ayush Mantralaya, Health Ministry. Both they know about, and
no, you can send it to us, because in our editorial board, which is very
sure.
we have
specialists,
we have people from the fields that you just mentioned. We have neurologists, Ayurveda physicians, we have yogacharyas, and molecular biologists, biochemists, all of them together. We will counsel them. And in fact, I would like to go one step forward, and we can talk later to have a slot for your another presentation of case series where what you're mentioning can be presented with imaging modalities and
No,
the
sir, this is the physical correspondence. The second part is the most beautiful.
functional.
That is the metaphysical correspondence. These four fingers, even this left small finger, having three joints, have the treatment of the 10 arteries of the heart, coronary arteries, also the SA node, AV node, and the four chambers, and all the valves, and similar, all that. Similarly, uh, on this small finger, the treatment of the all the zones of the lungs and large intestine. It means that in the current perspective, both small fingers, just to boost the immunity, enhance the immune system, all these, both these. And this is the second part, that is the metaphysical, shotas, meridians, channels, pathways of the energy. It was just, this is the physical correspondence. And metaphysical, when we have to see that specific vertebrae, there is L4, L5, protrusion of the disc or the degenerative changes in multiple vertebrae. So we have to give the specific treatment each and every. In most of the cases, C5, C6, all the 30, these have the 30 joints, including this. And the magic can be seen of Almighty God, that sometimes it is working uh, like this, like this, like this, like this. And this is the dynamic uh, principles and the vision and things,
Thank you
all
very
the
much.
things converted.
We look forward to your submission of these papers which define and describe what you're claiming. And we really are very eager to receive submissions from your huge faculty and
But
people.
I would like to make one correction, that we never claim. The patient tell, we recorded. I
Sure.
never claim, and
Right.
I will never claim, but and I will not come into, I will try to come into interaction, and the all the results will speak themselves.
So you
Whether
have
it
to
is,
first engage the patient who describes these benefits and
yeah.
has benefited. You can employ a group of your faculty to write that up what the patient feels.
Yes, they are writing, they are writing.
Records of documentation of results,
Sir,
biochemical or clinical results
doctors,
before treatment and after treatment, and put them
yeah,
in a
yes,
introduction.
this has been done. In
And
more than 1,000 cases, this has been done.
yeah,
More than 1,000 cases.
so submit to us
And
also integrative medicine case reports.
we'll submit.
We are making it a citizen science,
Oh,
very,
yes,
very proliferative,
exactly,
disseminative,
exactly.
and with the
Sir.
goal of taking it all the way to the hospital, the main hospitals. So that's our idea.
Yeah.
We advocate integrative health and for the benefit of the patient, as you rightly said. So
Many of the
very
medical
much again,
doctors are
I would like
many
to,
of the medical doctors are monitoring these case histories.
I'm sure.
Thank you.
Thank you very much. Thanks a lot. Thanks to you.
We publish a magazine, Saraswati, from 2000. We'll send the in there the latest case histories are there. We'll send you.
Very
Thank
nice.
you.
Thanks
Namaskar.
a lot for coming.
Namaskar to everybody. Lot of thanks, and I express my gratitude to the Pgimer workshop, and especially to Dr. Anand and his team.
Thank you.
you.
Thanks.
Namaskar.